Hi there, I'm Dr. Christine Stewart at Abdominoplastic Surgery, and I'd like to talk to you about Mommy Makeovers. First of all, what is a Mommy Makeover? Who benefits from one? And what about timing? When's the right time for a Mommy Makeover? So first off, what is a Mommy Makeover? I'm sure you guys have seen this term on the internet or heard it amongst groups of friends and kind of wondered, what exactly does that include? Well, it really depends on the patient and her goals surrounding her mommy makeover. I like to think of mommy makeovers as 2 or more procedures within the same surgery or general anesthetic. I think those procedures fall within 4 different categories. The first category is really tummy or abdominal wall contouring. Most women after pregnancy have some excess skin or fat, especially in their lower abdomen, that's really hard to get rid of. They may also have a rectus diastasis, which describes the space or bulge in between your six-pack muscles, where in pregnancy your six-pack muscles separate, but they never quite make it back together, and it results in an abdominal bulge that's really hard to fix, no matter how many planks or sit-ups you do. These issues are most commonly fixed with an abdominoplasty, and at abdominoplastic surgery, my partners and I usually add liposuction to our abdominoplasties to help contour the hips and waist area. The second category of surgery is really breast surgery. Postpartum, most women will notice that they have some breast deflation as well as some sagging or ptosis of the breasts. In these situations, a breast augmentation with a lift or just a straight lift may help these issues. Other women, conversely, actually have hypertrophy or growth of their breasts after pregnancy, and these women desire a breast reduction. The third category is liposuction at some other site. We all have our trouble spots, and this doesn't change after pregnancy. So a lot of women will choose to do liposuction at the same time of their hips, their outer inner thighs, their arms, more and more commonly the neck and jawline at the same time as a mommy makeover. And then the fourth and final category, which is also kind of a newer category, is surgeries surrounding the vulva or labiaplasty. After pregnancy, some women notice that they have lengthened labia minora or labia majora, and that these areas also appear deflated. For some women, this is purely an aesthetic concern, but for others, it's actually a functional concern. Women can have issues with hygiene in these areas. They can have discomfort from chafing of the labia minora against the labia majora during vigorous activity, especially with tight pants on, like yoga pants. And still others actually have issues with sex where the labia minora is actually so long it sort of blocks penetration. And so for those reasons, they decide to undergo labiaplasty. So who benefits from a mommy makeover? Well, obviously women who have had children. We all know that childbirth is a gift and a process. We wouldn't give our children up for anything. But it may cause changes in your body that you can't fix alone with diet and exercise. And that's really where a mommy makeover comes in. There are 2 different groups of moms that are pursuing mommy makeovers. The first group is a younger group, women in their 20s, 30s, maybe early 40s, who have just finished having children. And they want to know, how long after my last child can I have a mommy makeover? And we'll talk about that in the timing portion. The second group of women are actually women in their 50s and 60s, and they've had children about 20 years ago. And now the children are out of the house or will be soon, and they're wanting to do something for themselves that they've been putting off for this many years. And the question I get from them most of the time is that, all of these blogs I see are of like 30-year-olds. Am I too old to be having this procedure? And the answer to that is no, of course not. So what about timing? Well, if you belong to the first group of women and you've just recently finished having children, there are 2 things that you really need to consider. The first is we recommend that a woman take about a year off after her last pregnancy in order to let your body recover from being pregnant as well as to give yourself time to get within about 10 pounds of your goal weight. The second consideration as far as timing goes in this group is if you are breastfeeding postpartum, you'll want to stop breastfeeding about 6 months before any sort of breast procedure that you have done during the time of your mommy makeover. For women who are in the older group in the 50s and 60s, there are other changes affecting your body at this time too. It's harder to lose weight, maintain weight. And so for that reason, it's important that you've maintained what you feel is your ideal weight for about 6 months prior to pursuing a mommy makeover. So I hope I've helped you learn a little bit about what we mean when we say mommy makeover and given you some things to think about as far as timing goes. My next video, we're going to talk about the 7 most common questions about recovery from a mommy makeover. If you have any questions about the content in this video, you can feel free to comment in the comments below or also link to our website. Thanks again for watching, and we hope to see you at the next video.